Good morning, everyone. We're just going to let people log in here for the next couple of minutes. So feel free to make yourself at home, get yourself a nice cup of coffee or a glass of water, and we'll get started shortly. For those of you who have joined us, I just want to let you know that this is a recorded webinar. So if you have any questions or comments that you want to add in here, please encourage you to use the chat function. Thank you. Good morning, everybody. My name is Russell Baker, and I have the pleasure of serving as the IABC Toronto president this year. We're just going to give people a few more minutes to join us this morning, and then we'll kickstart the session. But while we are waiting for others, I did want to note that IABC Toronto is seeking your feedback on how to be more inclusive. So if you're part of an underrepresented group, I'd like to extend an invitation to you to join us at one of our open forum discussions this month to share your thoughts, ideas, and experiences. From there, the IDEA Committee, focused on inclusivity, diversity, equity, and accessibility, will use this information, along with information gleaned in similar sessions earlier this year, to make recommendations to the board on what changes we can make to impact our community. So more details about that, including the date and registration, can be found on our website at toronto.iabc.com. Just a couple more minutes and then we will get started. Thank you. Okay, good morning, everybody. I see that we've got a number of attendees with us this morning, so I think we'll get things started. So for those of you who missed my comment earlier, my name is Russell Baker and I have the pleasure of serving as your IABC Toronto president this year. We are in for an absolutely incredible webinar this morning, in which we are going to hear from 4 respected Toronto communicators about their experiences communicating during the global pandemic. So feel free to live tweet this event and follow along using the hashtag IABCToronto. Sorry, I see we might be having a technology issue here. 1 second. Let's see here. I see that many people are only seeing a black screen here and not actually seeing our videos. Let's see here. See what we can do. Bear with us. Apologies for the inconvenience this morning, everybody. Okay. Can I ask, Sophie, can you try chatting for a quick second to see if anyone can see your screen or if it's just a problem on my end, maybe?
Yeah, absolutely. Good morning, everybody. Zoom adventures. Gotta love it, right? COVID has been one test of technology after another. So, and I've been training clients, you know, every single day on how to navigate this, and still every single day, either I come up with tech issues or my clients do. So it's a good thing everybody's pretty chill about the struggle, because the struggle is real.
Okay.
Can you
Thank you,
hear me okay?
Sophie. I understand that it's probably just my video. So, you know, that is okay. Oh, okay. Now, okay. So I was just having computer problems. So my apologies. So thank you for your patience this morning. Certainly appreciate it. Yeah, we'll pick up where we left off then, Q. So great. So feel free to live tweet the event and follow along using the hashtag IABCToronto. And don't forget to tweet about our speakers as well. So feel free to use their Twitter handle. So we see, and it's in the chat function as well, that Brad Ross is at Brad Ross TO. Jackie D'Souza is at Ms. Jackie D'Souza. Sophie Nadeau is at Sophie Nadeau. And Jillian Howard is hashtag Jillian Howard. And I'll be your moderator today. So feel free to follow along on my Twitter handle as well at Russell Baker. And there's 2 R's at the end of Baker. So before we get started, I did want to note that today's webinar is being recorded so that we can share the pearls of wisdom from our 4 panelists today following the session. We are running today's session as a webinar, as you probably already noticed. So you will only hear and see our 4 panelists and myself as your moderator. I do encourage you to enter any questions you have into the chat function on Zoom. And please I would please encourage you to share them with all attendees so our lovely IABC Toronto volunteers can compile those questions and share them with me so that we can do our best to address your questions throughout the session. So with that, before we officially kickstart things, I'd like to ask that each of our panelists take a moment to introduce themselves. So with that, I will ask Jillian to start, please. Oh, Jillian, you're on mute, sorry.
I thought you were going to unmute me, Russell. I'm Jillian Howard. I'm Vice President of Public Affairs and Communications at University Health Network, which is Toronto General, Toronto Western, Princess Margaret, Toronto Rehab, and the Michener Institute for Education at UHN.
That's great, thank you. And on to Jackie, please.
Hi, everyone. I'm Jackie D'Souza. I'm the Director of Corporate Communications at Ontario Power Generation, which is, I've got about 30 years of communications experience in varying industries, mostly government, some sport, and a hospital as well before joining, and the City of Toronto before joining OPG. Thank you.
Thanks for that, Jackie. And over to you, Brad, please.
Good morning, everybody. My name is Brad Ross. I'm the Chief Communications Officer for the City of Toronto. I rejoined the city in January of 19. Before that, I did about 11 years at the TTC, and before that, I was at the city doing media relations and issues management. So happy to be here. Thanks for the invite, Russell.
Thanks, Brad. And last but certainly not least, over to you, Sophie, please.
Sorry, I was just trying to unmute myself. Good morning, everybody. My name is Sophie Nadeau. I'm the National Media Lead for Edelman. We are a global public relations communications marketing firm that helps clients every day communicate the stories that they have to tell through a number of channels. I've been doing this for about 25 years. Prior to working for Edelman, I worked for the US Embassy in Ottawa, supporting the Obama administration with communications here in Canada. I've been in comms about half my career. In the first half of my career, I was trained as a journalist, had the pleasure of working in a number of newsrooms as a reporter and a producer. So really happy to join the conversation today.
Great. So thanks to each of our panelists for that excellent introduction. So with that, we're going to dive into our first question. So at the beginning of the pandemic, not much was known about the coronavirus, and Canadians were looking for answers. Jillian, in your role at the University Health Network, how did you manage this uncertainty and fear among your internal and external audiences? Did your experiences with the SARS outbreak, for example, help prepare you for the pandemic?
So a couple of things. I think like everybody, the prime thing that we have to remember is nobody knew anything about this disease at the beginning. We were watching Italy, some pretty terrifying images, and also China, people in hazmat suits dealing with patients. And so there was, within the hospitals, and I'm probably talking about all hospitals, a lot of fear. So people were acting through fear. They're professional, they need to know, or they know how to conduct themselves, but it was a scary time, which was also true in SARS, but this was much broader. So for our internal audiences, and I would say the first part of this for us was really about our internal audiences. We were doing virtual forums with the CEO twice a week, taking anonymous questions, answering everything that we could, putting our experts forward on those forums. We had lots of working groups on specific things. So they were also communicating everything from our screeners at the door and all of the information about that, the redeployment of staff in the organization. So lots and lots of information, difficult for people. We also had to create new tools. So the availability of PPE at the beginning was a big problem. People were scared that we were going to run out. And so we created sort of visual tools about days of supplies that we had for all of those things. There was never enough, but we were quite fortunate at UHN. And I think the other thing that people wanted to know, which is odd in a hospital because we try very hard to protect personal health information, was the number of patients that we had in hospital with the virus, the number of staff members who might have been infected, and the kinds of testing that we were doing. So we've created those tools. One of the difficult things is when we get to very low numbers, we really can't share those because you're identifying people within the hospital. So new tools, lots of communication to the internal audience. Externally, everybody was interested in COVID. We obviously had experts. So Susie Hota and Alon Weisman are the two people who deal with infection control. They didn't really have the time in the beginning to do a lot of the interviews. So a lot of our infectious disease people were doing interviews, but they aren't the infection control people. So we're now trying to put Susie and Alon forward much more often because it's calmed down. So lots and lots of communication. Fear is a difficult thing for people. Sometimes they don't hear.
Great. Thank you for that answer. Certainly appreciate that. So next question is for Brad. So federal, provincial, and city officials have played an important role in educating the public and providing leadership to Canadians. In a recent survey of IABC Toronto members on crisis communications and challenges, 67% of our members said that reacting quickly enough to the crisis was one of the biggest challenges that they face. So Brad, in your role at the City of Toronto, how did your team respond quickly, and how did you mobilize a response with your teams? And the second question is, how did you work closely with the mayor's office to ensure that your communications were aligned?
Okay, thanks for that, Russell. I'm sorry, I got booted off and I'm back on now, so hopefully you can see and hear me. You're frozen there, Russell, and maybe it's my connection. But so an excellent question, and I think, you know, responding quickly in any crisis, of course, is critical. You know, your credibility as a government, especially for something as serious as a pandemic, you know, you have very little room for error. I think what's most important is that you acknowledge what you don't know. And I think, as Jillian mentioned earlier at the outset, you know, we knew very little about this disease. In fact, you know, in January, we started planning around at least messaging for our own employees and thinking about what we're going to be saying publicly when COVID-19 really started to take hold. And then, of course, in March, when the WHO declared a pandemic. So, you know, being nimble in having a team that can respond to quickly in ways that you might not otherwise think about. So, for example, our website, toronto.ca, we had to, in fact, rebuild overnight the front page to our website, because if you all recall, on March 13th, that's basically when everything kind of shut down, right? City Hall closed, the civic centers closed, libraries closed, the zoo closed, you know, counter services at those civic centers, everything kind of shut down. And so it was very important that residents and businesses had up to the minute information, but at the same time being able to tell the public that there's much we don't know, but here's what we do know. And then what we ended up doing was media availabilities, literally 5 days a week, sometimes on Saturdays, right through into mid-spring. We started to pare them back a little bit, but constant communication, updating our web pages, using social, you know, all of those obvious tactics. The problem is, of course, there is no playbook for, and was no playbook for COVID-19, and we're still figuring it out. Information and guidance from public health continues to change even to this day as science learns more about the virus. And so having a team that is able to react, that you're able to move people around as the case may be, as necessary. So that's a bit of an answer to your first question, Russell. On the second point, you know, political leadership is looked to during something as serious as a pandemic. Political leadership is accountable ultimately to the public. They look to political leadership for direction, for answers, for swift policy changes. And so as staff, it is important for us to work closely with that political leadership to ensure that that those policy changes are well communicated, that they're well thought through, you know, all of that issues management, all of that media relations, using social to support the mayor's office and support the mayor, as well as other elected officials such as the chair of our Board of Health, Councillor Joe Cressy. So, and we have continued to work very, very closely with the mayor's office. There is still a declared emergency in the city of Toronto. The first time a declared emergency has ever been called. And so that continues, and that close working relationship continues as well.
Great, thanks for that, Brad. That was very insightful, so thank you. So on to our next question. So the pandemic has certainly caused major shifts in virtual teams and internal communications. So Jackie, in your role at the Ontario Power Generation, I'm hoping that you can speak about how you managed your employee communications and how the organization addressed their questions and motivated them during this challenging time.
Okay, thanks for the question, Russell. I mean, it certainly was a challenge. We have a very we developed a very comprehensive communications plan that addressed both employee and external communications, but obviously I'll stick to the employee side for this question. And you know, our company has a huge focus on safety, so that was paramount to us. Key objectives in our communications plan. One, inspire. So we wanted to motivate our workforce to continue to rise to the challenge. You know, we used words like unprecedented crisis, but we still wanted to recognize their efforts both internally and externally. Inform was one of the other objectives. You know, make sure that the communications was frequent, clear, transparent. You know, that we were doing everything we could to ensure safety while continuing to supply power. We generate 50% of the power in the province. So, you know, in terms of motivating employees, we wanted them to understand how important what they were doing was in terms of powering hospitals, businesses, people at home, etc. In terms of the transparency too, we told employees when there was a COVID case. I mean, obviously high level, we didn't identify everybody, but just to let them know, thank goodness we had, because of our protocols that we had in place, we had very, very few cases and none that were transmitted in the workplace. So most of the people who ended up having COVID hadn't even come into work. Some had returned from March break and never went into the office. So that was, you know, in terms of the three objectives: inspire, inform, and then mobilize. This was a little bit of an external piece, but we also made sure we informed employees of what we were doing. You know, we wanted to really show our leadership as corporate citizens. You know, we were able to donate to some areas of public needs, such as healthcare. We ended up donating about over 1 million pieces of personal protective equipment, mostly masks, to the province to distribute to hospitals and long-term care homes. We donated to food banks, you know, help with some educational programming, etc. Also created a generating kindness page, we called it, our intranet site, and encouraged employees to donate to causes in their own communities as well, and many of them did. And then certainly on the internal communication side, you know, the very first email that went out from our CEO, you know, telling staff that we were starting to work from home in terms of the office staff, you know, told them that we knew they were up for the challenge, etc. We kept them updated through these update emails that were sent regularly to all of our 9,500 employees based on information that came out of our crisis management communications center. Just to ensure they were in the loop, that they were aware of what was happening. We had electronic signage throughout all of our facilities that also provided information. We created a specific COVID-19 web page that became sort of our one-stop shop for all resources, including FAQs that we continued to update regularly and shared via email. You know, one of the stats we found is that those FAQs reviewed around 30,000 times in the first few months. We also had to think about different information for different audiences and sort of segment our audiences a little bit, because we had, you know, the power workers and other staff working directly for the stations themselves that had to continue to go into work every day. And then, you know, another group of staff who were more office employees who had to stay at home. So we ensured that there was, you know, separate communications for those audiences as well. And then one of the big initiatives we started were these bi-weekly virtual town halls featuring our CEO and our chief physician, as well as other senior staff. And I moderated those, and, you know, you could tell people were desperate for information. Because we had probably around 5,000 on each call, which was a really good number for the number of staff that we have. It was over half of our entire staff base. And we knew in some of the stations, these calls were on speakerphone and people would gather while physically distancing in, a bigger room or auditorium and actually listen. And our staff are not shy. I mean, people spoke up, they asked questions of our CEO, they wanted to know what was happening. And it was a good opportunity to connect staff directly with senior leadership to have their questions answered. So I would say overall a very comprehensive plan, and just a quick shout out to the internal communication staff who are continuing to work extremely hard on this, as well as our other return to work plans, which I can get into a bit later on. So that's it. Thank you, Russ.
Thank you. Appreciate that. Does any of our other panelists want to weigh in on that question as well about what they were able to do in terms of internal communications?
Yeah, if I could, Russell, Jackie clearly has done a very comprehensive and excellent job, and it was the same approach for the city. We have, about 35,000 employees who work for the city of Toronto in total, and many of them had to continue to work providing those frontline services, such as garbage collection, for example, keeping the water safe to drink. So reconstituting how we communicate, and internal communications is so key, especially in the public service. An informed public service means an informed public, frankly. And to Jackie's point, there was tremendous appetite for information. Like Jackie, we've held town halls as well, and WebEx town halls, and we've seen several thousand people join it. So clearly, employee communications is so critical, especially when you're working from home and relatively isolated from your coworkers. You can't get together in a meeting room or have those face-to-face meetings in person. So important.
I would also add to that, in our experience with a huge diversity of clients in the private sector, that through this time, it's become very clear to us that internal comms are actually external comms. So, everything that you're sending to your employees about how you're handling work from home, how you're handling COVID cases, how you're handling adjustments, we found with a number of our clients that, that's going to leak to the press. It's almost, there's like a complete conduit between the two. And so you can't really divorce internal and external anymore, especially in the current climate. And so, to hear the excellence that was put into those internal comms, that filtered into external strategy as well, which, makes sense given the current climate.
Jill, I think that's absolutely true. I mean, we expect that everything we do will go public, and frequently does. And the other part of that is when we have something to say, we will often draft what we're going to say about it and post it. And then it's very easy to say to media, this is what we have to say about that topic.
All great points. Thank you so much. I think it's very fascinating to hear that, there is certainly an alignment in terms of the, internal and external communications environments and how they are very similar in a lot of respects. So thank you for that. I just wanted to remind our attendees as well that if they have any questions at any point during the session today, they can type it into the chat bar, and we'll be sure to ask our panelists as many of those questions as we possibly can. In the meantime, to give our attendees some time to think of those questions, my next question I have here is for Sophie. And so we have seen in the last several months that government and healthcare organizations have been at the forefront of the pandemic and played a vital role. However, many organizations have not had a central story during this time. So Sophie, I'm wondering if you can share with us how Edelman has been working with its clients in the private sector to respond to the national pandemic, and what sort of communications or what communications has looked like during this time for your clients?
Mm-hmm. Well, it varies depending on obviously the client, and we work with people from the corporate sector, in tech, in health, in brands, consumer packaged goods. We work in all of these spaces. I think what became abundantly clear at the beginning of this COVID crisis was, I think many media experts have called this the everything story. And it's been pervasive in a way that, I lived through 9/11, we all lived through SARS, like all of these huge stories didn't even come close to the scope of this pandemic. And in the beginning, a number of our clients, were slow to kind of catch up. We were all stumbling through, everybody all of a sudden was working from home, and we're like, okay, well, what does this mean? What does this mean? And with every passing day, it became clear, okay, well, it's not just Brad's job to tell Torontonians how to manage this. Employers all of a sudden had to play a key role in disseminating public health information and to say, yes, you're going to work from home, and this is how we're going to manage it. And so there were so many things at play there that challenged communications teams within our client set. And we had to kind of adapt because, again, some of the companies we represent are essential services and had to send their people into work, and some are not. We at Edelman do a lot of research on how Canadians trust institutions. Every year we put out our Edelman Trust Barometer. It's the largest institutional study of its kind globally, asking respondents, how do you trust government, media, NGOs, and business? And we did a special trust around COVID because we wanted to understand what the Canadian expectations were of business. It makes sense that Torontonians are leaning in on the stuff that Jackie and Brad and Jillian are doing because they are key. They're right at the center of it. But do we care about business's role? And as it turns out, our research says yes. So 81% of Canadians want brands to do the right thing. And I know this is a favorite thing of Brad's that I've heard him say over and over again, good comms is doing the right thing. Well, as it turns out, Canadians want businesses to do the right thing when it comes to COVID. 93% of respondents said they want business to partner with government in creating solutions around COVID. So it's not enough to just handle your own employees in your own business. There is an expectation amongst Canadians that business get involved. 88% said they wanted business to be the safety net to fill the gaps. So, Brad and Jillian can't do everything when it comes to COVID. So how are you supporting employees? As this crisis has gone on, a number of our clients have had to lay people off, have had to access government support, which means following very closely the supports that the federal government and the provincial governments have been affording individuals and businesses. That's been extremely complex. Most of all, 84% of Canadians want businesses to connect and create community. So that giving back that Jackie talked about, companies, donating PPE, making donations of that kind of sort has been really important. But what I have noticed is a number of clients do remain frustrated that they can't actually get involved. They're not in the news cycle. There's no way. Like, you can make $1 million donation on COVID. Nobody cares. Nobody cares because we're worried if our kids are going to be in school past 2 weeks, right? Nobody cares because, the news cycle, it's not just COVID anymore. Black Lives Matter and diversity and inclusion, the presidential election. I've never seen the news cycle this charged. And so clients are trying to think about, okay, well, how do I play in this space? If you don't have a legitimate and authentic connection to COVID, you don't have a right to play in the news cycle. It's just not going to work. And so we are, for those folks on this webinar who are not in this day-to-day, we're looking at more integrated ways of reaching your target audiences. So it's really important to know who you need to reach, find out where they are. There's a huge uptick in social media consumption. People don't trust it, but lots of people are going there. Folks are tired. News avoidance is growing, and so people are looking for entertainment and diversion and things that don't involve COVID. So there's opportunity there. So there's just a lot to think about. And in a weird way, Brad and I have joked about this before, but as a communicator, there have been days where I wish I was Brad, because he's got a daily press conference and a pipeline, and the reporters are all fixated on that, and for good reason. So for those of us who aren't playing in the space, it's really challenged us to be more creative and more thoughtful about how we manage costs.
I'll trade you places any day, Sophie.
Okay, cool. Deal.
That's great. Thanks for that answer, Sophie. That was very enlightening. I certainly appreciate that. We are getting some questions from some of our attendees. So I've got a question here from Carly. So how were you able to deal with communications resources? And did, as business as usual sort of halted, quote, right, were added resources brought in, or how did your companies come up against that? Maybe we can start with Jackie.
Sure. So we actually halted all other communications and just focused on COVID-19. We had lots of projects on the go, as everybody does, lots of initiatives that people wanted to communicate both internally and externally. And we just put a hold on all of that stuff because we had to use our limited staff and internal resources and external resources as well to focus just on managing COVID and our communications around that. We actually had to stop major projects like our Darlington refurbishment project, which is the nuclear plant. It's an almost $14 billion project, and we had to actually halt it for a few months just to get people off the site so we could maintain physical distancing for the essential staff that had to be there. You have to keep people motivated though. So we continue to get out those stories around, the PPE donations and some of the donations staff were making, et cetera, and encouraging staff actually to share on their own social channels as well, just so that they would have something positive to say in this difficult time. But yeah, it wasn't until mid-May that we started to think about returning to the workplace and getting back into some of those communicating about initiatives that we had sort of put on hold for a few months.
Great, thank you. Any
If
other
I can,
panelists
yeah,
wanna weigh in?
if I can jump in on that. So when COVID happened, pretty much all of the clients on our client list had to think about, okay, wait a second, we can't do this anymore. And so, a number of campaigns halted, stopped, in some cases, huge pivots. And so, I was thinking this morning, the Wall Street Journal is adjusting their advertising platforms so that they can turn around ads more quickly. And it made me think, the days of long range comms planning are over. If not over, at the very least, we have to be a lot more nimble to be able to make adjustments to account for what's happening in the news cycle. How do you connect with the stories that are happening? A number of companies are dealing with a huge economic downturn. So then there's a question of comms budgets, right? Do you even have cash to run ads that maybe nobody will see? So it's forcing a lot of thinking, and so we saw huge adjustments amongst many of our clients in terms of their plans. And I think it was very stressful for people, right? Because on some level, when I speak with clients, I get the sense that there's still this hope that things will go back to normal. But, I don't know, you tell me, Brad, to me, at the very least this fall going into 2021, we're dealing with this, complete uncertainty into the foreseeable future.
Yeah, it's Jill. I think the whole team was doing this for quite a long time. We did make some changes. So, for example, for a period of about 2 months, we put one person on our media response, so that was the person who knew everything that was going on, which is not normally the way we do it. But since it was all about COVID, it made sense. I think we put projects on hold. We're now starting to see those coming back, but we're, like Sophie just said, we're all a little like, oh, it could stop again. I think this is going to be with us for a considerable period of time, and I think we've just got new ways that we're going to have to work. And I know that's people want it to go back to normal. It's not going to be normal for a long time.
Yeah, I mean, our everything that wasn't COVID related came to a grinding halt in mid-March. I sometimes joke that I feel like I work for COVID-19 Incorporated. I mean, everything is focused now on this pandemic, and initially the response to the pandemic in terms of this thing called social distancing that then morphed into physical distancing as we tried to explain what that meant. Staying home, only going out when absolutely necessary, working from home, the technology that enables working from home now. I mean, at the time of all of this, the city only had limited capacity for people to be logged into the network simultaneously. That has obviously changed, and it changed very, very quickly. So kudos to the city's IT folks. But and we're not unique to any of that. We have slowly begun to communicate other issues. but mostly they are related to COVID-19. So around recovery and restart. And making sure that they interrelate, because clearly we don't want to be, and nor would we ever be, sort of tone deaf to what is happening. And resurgence is not a matter of when, or it's not a matter of if, rather it's when. In fact, I think some would argue that we're seeing that now, and so. Resurgence planning is well underway, and making sure that your teams remain nimble. We have really not changed how we sort of structured ourselves at the outset of this, very ad hoc, frankly, in terms of a structure. And at some point, we need to go back and look at, does this structure now need to be set? And how do we do? And so there's all those managerial and administrative sorts of things that we need to look at and do to ensure that, and I'm just looking at some of the chat here, to ensure that our teams do not burn out, that morale can remain high, that as leaders, we need to make sure that we are communicating with our teams regularly and effectively, and keeping them in the loop as to what is happening and what we're doing and the direction we're going, recognizing that it can change on a dime. So we have stayed the course for the most part with respect to our response to COVID-19. As I say, we have started to open it up a little bit more, especially on our social channels, about other things that are happening at the city. And again, to support the restart and recovery of the economy as an example.
Great, thanks for that, everybody. Really appreciate the insights there. I'm going to move on to another question that we got from one of the attendees here. It's from Karen. So she said that Jillian mentioned that where fear is involved, people don't necessarily listen. So wondering if the panel can expand a little bit more on that from a communications perspective, and how you are getting past the quote wall of fear people have about the repercussions of the pandemic and the pandemic in general.
So I'll start. I think there are a couple of things. One is the ability that we have to focus on the stories of solution. So for example, our story today is about the work that's being done around small molecules and current drugs that we know are safe, that look like they're useful in treating COVID. So we're looking for the kinds of stories that say, here's some solutions. We're talking to the staff within the organization about some of the approaches that our nursing staff have taken, for example, in the ICUs. They've now moved all the equipment out into the hall so that they can monitor and reduce the number of times they go into a room if somebody has the virus. So I think that's part of it. I think as we get more knowledge, it is clear that this is largely droplet spread, but airborne in closed environments where the ventilation is poor. And so getting that information out, talking about the kinds of things that we're doing to address the things that we can address. And also, certainly going forward, this is, for us, it's difficult because there are some people who cannot work from home. You can't nurse in an ICU from home, but there are many roles in the organization where working from home actually probably is going to be ongoing and makes more sense. And there are advantages to that. So we're currently working, we have a task force working on what does work from home look like? What are you going to have to do to satisfy the organization that that's something that is going to be better? And then also, I think there's a perception of unfairness. You know, I'm not in the office today, but I can work from home. Leadership really needs to be here, I think, even if we can work from home most of the time. But we're going to have a process that if you really think you can work from home and your manager is saying no, that there, you know, a third party will be involved. I think this is going to change the way we all work. And I also think, I mean, we've been going through a pandemic with huge numbers of virtual care for our patients. For the right thing, our patients absolutely love it. You know, I don't have to come from Barrie to see my oncologist for a 6-month checkup. I can talk to him on the phone. Delighted. I think we have to do the research that says what is good care at home and what do you really need to come in for.
I can talk a little bit about that fear perspective as well, because I was reading new data from Angus Reid this morning, and it's depressing. So half of Canadians expect things to get worse this fall, and over half are stressed about COVID, which is understandable. But we're 6 months in, right? So this is 6 months of prolonged, sustained anxiety for people. And, you know, the news cycle very much is driven by both, you know, that fear, emotion sort of element, but also the fact that people want to consume information that is of particular importance to their individual circumstances. So one of the key things that we've found for at least businesses to engage in that conversation is to focus on solving problems and not selling. So old school PR, you know, you put out a press release, hey, we have a new product, or hey, we're doing something interesting. And the expectation was it would get out there. And right now in the current climate, like if you're not playing a positive role in making life better, your chances of getting attention are quite diminished, if not only because people are really, you know, jacked about what's happening with COVID. The other thing too, and I don't know if we can assess this properly until we actually move through more of this, but clearly the stress and anxiety of making these adjustments and dealing with change and dealing with the news cycle the way that it is has had an impact on communicators. So I'm very worried about, you know, my reporter friends and on, you know, people like Brad who have been working 18-hour days for 6 months. You know, it's not sustainable. And I think to be able to think intelligently about how we're going to manage this, you know, people who are in the throw of things need to take a break, right? You need to turn off the news. You have to take a moment to kind of ground yourself to be able to survive this crazy time, right? So it's something I think about a lot. I mean, the difficulty though is the business model for journalism has so much shifted towards, you know, prolonging that anxiety, prolonging the fear, right? And I don't know if that, I mean, over time it'll probably make it worse and makes it more challenging for us to do our jobs.
I think this is a great segue to another question that we have based on the way these answers have gone, and that is from Catherine here. She's hoping that Sophie, Jillian, and I think Brad can give some examples on how to bridge the gap between the desire for normal and what was once, you know, status quo, and the reality of the pandemic that we're living right now that will be with us for quite some time. So the question really is, how do we adjust our expectations on living so that messaging can connect?
You know, it's interesting. I think the other challenge that's ahead, at least for the hospital sector, I think that people who have long careers may decide this fall that they don't need to do this anymore and they're going to retire. I think that's going to be quite common. You know, with everything like that, the opportunity may open up for some of the younger people who really want, we've just had an example. We've been working in long-term care homes for quite a while, since the beginning. One of the nurses who was doing that has discovered a passion for long-term care, and she's actually joined the city, Brad. So there are opportunities, and I think we have to talk about that. But from the beginning of this, the thing that I've been telling my staff is, you know what, you know enough about this every day at work. Don't go home and watch the news all night. You need to check out. And I think that's an important message. And I agree. I mean, at the beginning, we were all working 7-day, you know, work weeks. I have said to the team here, you've got to take vacation. You cannot just keep banging on at this because it's going to be here. But we're also going to have to talk about what is going to be normal, and normal for us in the future is masking and washing our hands and physical distancing and staying out of strip clubs.
Which I've managed to do, Jillian. I would add, Russell, that, you know, depending, you know, our division is called Strategic Communications Division, maybe you're called the Corporate Communications Division, whatever the title of your division is, I think you might want to add expectation management to all that you do. And I think certainly going forward, managing people's expectations, managing the public's expectations. I know we saw last week some very disturbing news out of the United States with respect to its leader and what was not communicated to the public. I think, you know, we do all do ourselves, and I don't think I'm saying anything to anybody on this webinar who doesn't know this, that the public we have to give them far more credit than some people do. That they deserve the truth. They deserve to know exactly what the current situation is. And if the current situation is that we are going to be wearing masks when we leave the home, when we leave our homes, that we're going to be working from home, that we need to maintain that physical distancing, that we're not going to be doing the things we used to do, traveling or what have you, that we all have a role to play in arresting this virus until at least a vaccine has been developed and is effective. And how long is that going to be? Honestly, nobody really knows. And I think it's, and I think we need to make sure that our employees understand that, and that certainly from the government, that the public know that is the reality. And it's not about, you know, under delivering and or under promising and over delivering. It's not that. It's about what is actually happening right now today. And I know in the early going of COVID, certainly what was happening this morning sometimes changed by the afternoon. And so it's, you know, it's important that that you recognize and acknowledge that fear, but I think there's also an opportunity for some hope as well, that by doing all of these things, by changing how we, you know, conduct ourselves every day, that by doing the right thing with respect to the public health guidelines, that we can get those numbers back down. And certainly we said at the outset when stage 3 was, when we reopened at the end of July for stage 3, at least here in Toronto, that we would see an increase in case counts. And that's exactly what we're seeing. But there are very specific issues that we are starting to see with respect to family gatherings that are a cause for concern. And we need to communicate that. We need to tell the public that, not with a finger wag and a lecture, but here is actually what is happening, and here's what we're seeing,
You know,
and here's what you can do.
You know what I think is the most interesting thing about the last 6 months, and I've seen a couple of articles about this, the idea of institutional grief. So we've all gone through these huge changes, and as individuals, like on a personal level, as a parent, like it's been a difficult 6 months, you know, worry about your kids, fine. But the idea of institutional grief, where entire companies and businesses, like the business model for some businesses now is dead and or dying. What are they supposed to do? Like, this is systemic shift, right? And we haven't had a chance to really grieve, you know, the adjustment. And so in my mind, it's the job of communicators, not just to manage expectations, which I think is really important, but it's also for us to be able to look at things objectively and try and help people through change. You know, we're not organizational management experts, but helping people through change and getting people to a point where we look at things realistically and we think about, okay, well, you used to be able to do this. Okay, now from a comms perspective, here's what's possible. I think that's our job, to try and help people through change, because it's really, really tough. And, you know, things that used to work, especially in comms, they simply won't work anymore. And so I think that's just tough for people, and folks are stressed. And I know for me, I try to attack these problems compassionately rather than, you know, getting all worked up, like look at things objectively and say, okay, well, what can we do here? And that's helped a lot. But the grief is there, and I don't expect it to abate anytime soon.
That's a really good point, Sophie. And I think part of this is also, you know, taking care of the mental health of our staff. You know, we have to make these resources available. Our company did that, and I think a lot of other companies have done that as well. And realize, as some of the others have said, you just can't keep banging out all of this stuff. You know, certainly communication staff have been working these extremely long days, but so is HR, so is IT, so have many other parts of the organization, while also dealing with this tremendous stress and this desire to get back to normal, whatever that new normal is going to look like. I mean, there are some silver linings for sure. We showed that we can work virtually. We showed that we can walk around with masks on. It's not going to affect our lives all that much. But I think you're right, Sophie, that there's this grief, institutional grief, but also just the grief of all of the things that we've lost, over the last 6 months or so. Trips canceled, family gatherings canceled, weddings, funerals, all of that type of thing. And it's weighing on our staff. It's weighing on all of us. And I think as organizations, we need to acknowledge that. We've tried to do that in our communications, but it's hard. You're trying to balance that with also trying to keep staff motivated and upbeat to continue to contribute and work, because I think that does give people an intrinsic sense of accomplishment and motivation.
Thanks for that. Those were all excellent points. I'm going to move it along to talk a little bit more about social media. So when asked about the different types of media for crisis communications, 69% of our members indicated that social media was the most important channel for communications. However, I think we can all agree that we've seen a lot of misinformation fueled on social media since the onset of the coronavirus. So I'm wondering if our panelists can, talk a little bit about how they've been engaging in social media conversations and how they are doing, or what they are doing rather, to help manage the misinformation from spreading.
I'm happy to jump in, Russell, and to kick it off. Look, I think we all acknowledge just how toxic social media can be. Certainly, we've probably all seen that both personally and professionally. I know I have. But I think it's more important than ever now through this pandemic that we address directly misinformation, that we be, in fact, the conduit for credible, up-to-date information. So many people are on social now, right? I mean, it's just, it's ubiquitous. Whether people like it or not, they go there and they get their news and information. Quite a few number get their news and information via social. Certainly traditional mainstream media is very important, and we continue to engage with the mainstream media, critical, because they're on social as well. So with all of that misinformation that can be out there, more important than ever that those organizations and individuals that have credible information, that are sources for information, such as government, such as public health units, such as hospitals, that they be out there constantly banging the drum, posting. And in fact, what we have now done, in addition to constant posting about COVID-19 on a variety of topics, is also telling good news stories. We've had a number of challenges, for example, in our shelter system. We've seen an influx and a higher number of homeless people in the city, perhaps coming from other jurisdictions, but we've had to expand our shelter system in terms of facilities, because we needed to create physical distancing within the shelter system. So that has meant leasing hotel space, for example, and leasing apartment buildings as transitional housing and temporary housing. And so there's a lot of positive stories that are coming out of that. We've seen, frankly and unfortunately, some backlash about some of these facilities. And so we are working very hard to engage directly with the public on telling those good news, positive stories. And we are seeing some very, very positive reaction to those. So I think social, and in all its forms, whether it's Twitter or Facebook or Instagram or TikTok, are those platforms, depending on the audience, are mission critical in how we respond to this pandemic. So your digital assets, basically, is what I'm saying. Use them, use them.
I think they link up, so we can use social to actually direct people to the information where on the website that we have more spaced it. And we've tried to put all of that together for our patients. The other part of it is, our CEO, Kevin Smith, tweeted something on the weekend that he was worried about what's happening, and he's been doing media interviews ever since. I don't think you can do that all the time, but I think if you are a credible source in an area that people are worried about, there's a way to spread that information. And to be frank with everybody on the call, we are worried. We're seeing the numbers go up. We're seeing more people in our ICUs, and we think it's because of gatherings and people are sort of letting their guard down, and we just don't want to go back there.
There's something really interesting happening, I think, for those of you who are on Twitter on a regular basis. The concept of doom scrolling has become quite pervasive. The idea that people are spending a ton of time on social, just scrolling through bad news. And in fact, by the research that we have, time spent on social is up in every single age group. So even older folks who, before COVID may not have considered are now looking at it. The trouble is that social has always been the least trusted form of distribution for news. And so we're in this, difficult space where people are there, but, how do we engage them? To Brad and Jillian's point, if you don't speak, somebody else is going to do the talking for you. Our global CEO, Richard Edelman, will often say silence is a tax on the truth. So if you sit back and don't fight and don't actually go for, defend the facts, then other folks are going to do that for you. And I think in Canada specifically, I've been very reassured about the quality of information that's out there compared to our US counterparts, where they're having huge problems with this information on Facebook and on Twitter. The other thing I will say is that I feel like in Canada specifically, organizations can do a much better job creatively engaging on some of these social media channels. I know this morning I very much enjoyed Paul Rudd put up a new video to try to encourage US millennials to put a mask on. TikTok is awesome. It's fun. I mean, I may be too old to enjoy it, but it's still really cool. And I think that there's more room to grow there to use social, because as this crisis progresses, news avoidance is real and is creeping up. And trying to get people to continuously connect with this data is going to be more and more difficult. And folks are looking for diversions because they're tired and they're stressed out and they want to be engaged in different ways. And in Canada, it's my experience that as communicators, we've been mostly risk averse. We're very careful, right? Our American counterparts tend to be more out there. We tend to be more, guarded and careful. So I wonder if this isn't an opportunity to actually flex our muscles and we can see some interesting TikToks on getting people to do all the things they need to do to stay safe around COVID.
Thanks for that. And I just want to say, no one is too old for TikTok. I think it's great for everybody. I downloaded it a few months ago and I, kind of regretted it at first because I wouldn't say I was doom scrolling, but I definitely was on TikTok quite a lot. So I can appreciate that. So we have time for a few more questions. I think this is an interesting one for all panelists. So Mauricio is asking, is saying that every crisis is different. And yet the COVID-19 pandemic certainly has brought new lessons to crisis management. So he's wondering, based on your experiences, what new skills PR professionals should strengthen or develop in order to help manage situations such as this?
Okay, I can start with that one. OPG really learned a lesson, not from COVID-19, but what happened prior to COVID-19 when there was people probably remember this, there was a false alert about the Pickering nuclear station that happened back in January. Quite funny because we thought that would be our biggest issue for the year. We found that, we were ready to react and say, okay, this is not true, this is not happening. And we were told, okay, the province is going to issue another alert saying this was an error, and they didn't for an hour. So then we had to get out there on social and say, there's nothing happening at Pickering. And I think, part of the skill set here, and not only a skill set, is just to react quicker and sometimes not wait for your stakeholders to do something quickly. And part of it, and Brad knows this, and likely Jillian as well, is when you work for an organization that's broader public sector or reporting directly to government, you sort of always have that that sort of reporting back that you have to do, and you're kind of working together as partners. And I think just in terms of errors, opportunities, it's definitely reacting faster. It's not waiting for things to fester. And I think, like someone had said, having other people tell your story then, because that's how the misinformation gets out there on social. So I think for communicators, it's being agile, being flexible, being quick to respond, trusting yourself that you know what the messaging is and you can get it out there quickly. Because what we've seen a little bit is people aren't sure and they don't feel empowered. And for me as the director, I can't do everything myself. So I need people to feel empowered, to feel like they know what the message is, get it out there as quickly as you possibly can. While ensuring that it's correct and we've checked it through the appropriate subject matter staff as well. So I don't know if that's a skill set, but it's really an attribute that we want to see in staff. And I think it works across the board for all sort of communications roles, both internal and external, is trust yourself, get the right information, and get the info out as quickly as you possibly can.
I would fully support and agree with everything Jackie just said. In the before times, and we had, these binders, right, on shelves, a crisis plan, and you pull out the binder and, you'd go through your lists, and, checklists are really important. Don't get me wrong, but, to Jackie's point, and it's been talked about a few times here already, being nimble, being able to respond very, very quickly to fill that vacuum, because I think, as Sophie pointed out, somebody else will do it for you. So, this is normal operational sort of crisis comms. If when you peel it all back. And so, yeah, I don't know if there's necessarily a skill set per se, but perhaps it's getting your senior leadership team and your organizations to recognize that new reality. Leadership communications, I think, is something that we're hearing more and more discussion of in the industry, in terms of the CEO, the leaders of the organization. Being authentic, being empathetic, but speaking frequently and acknowledging, if not to the public, if you don't have a role there, but certainly with your own employees and with your workforce. So, and yeah, building that confidence and giving staff the confidence and the trust in them to do what is right, not by gut and not to be crazy risk, to throw risk at the window, but not to be risk averse either. I think the public expects almost immediate response, and I think we do our organizations a disservice when we don't. So if there's one takeaway from all of this, it is to trust your instincts a bit more, and maybe build teams that are that have confidence to react much more quickly than sort of waiting, as Jackie said, for something to fester and then having to react and respond. Never a good thing.
I have a couple. So number one, this has, if you haven't already realized it, this has underscored the critical importance of comms being at the leadership table, next to the leaders, when stuff like this happens. Because it's not good enough to just take actions as a company to, help your employees, to help your business. If you can't communicate that properly, it's just as damaging as making the wrong strategic call. And it could create so many problems for you. And there are still so many companies that devalue comms and leave their comms people in the media relations office and don't prioritize that. And I think, in watching like Jackie and Jillian and Brad, it's very clear to me their organizations value excellent communications advice. They're there, they're listened to. It's folded into every decision. And I think in a noisy world, it's critically important to have those smart comms people at the table and ensure that they be listened to and that it be prioritized. So that's my number one thing. The second thing I would say is that it's more important than ever that comms people have a clear sense of context, because it can change on you in a moment. You know, it's not just COVID, Black Lives Matter, and all of the really important conversations around diversity. A number of companies were caught flat-footed on that because they weren't paying attention. You know, and I'm not saying you have to be on Twitter all day long paying attention to every single tweet and everything that's happening, but you need to understand how things are going to land. And, you know, those crisis Bibles don't work anymore, you know, and to Brad's point about instinct, you have to be in the space to be able to understand, oh, okay, if I say this, here's what's going to happen. You know, I mean, worst case scenario, you don't want a Twitter mob coming after you or your brand or whatever, right? So that's super important. And the last thing for me that's really important is good writing, clear, concise, accessible, short, not bullshit writing. and I say it only because I've seen so many communications documents that are pages and pages and pages of talking points, and oh my God, in a crisis, it doesn't work. And also, if you're trying to cut through the noise, it doesn't work. And people try to get fancy with their writing, and I'm like, it is not the time. Tell me what you're trying to say in 15 words or less, or I'm changing the channel. And it shocks me the degree to which comms professionals don't, you know, focus on clarity of writing. It's really important for me, and maybe it's just because I was a journalist for a decade. I just feel like that can make such a huge difference in terms of your outcome.
That's great.
I think we're all nodding our head in agreement. I sometimes think that what we do for the organization and for the people we work with is we translate. So particularly for us, we translate research language into very clear information. And we also sit with people and say, nobody knows what you're talking about. What are the three things that you want to say about your study? And I think that probably the other part of it is the trust of your senior leadership team in you, and that takes a long time to develop. And so those of us who have been doing this for a long time, you know, we've had the privilege of working with people who trust us, and that makes it much, much easier.
That's an excellent point, and actually is a great segue, Jillian, into a question we've got from one of our attendees, Jackie. So her question is really, you know, what lessons can we take from this experience? And looking forward, how do we take those lessons and build trust and build engagement with our various audiences?
There are two things for me about this. I wish in the beginning we had talked much more about the fact that nobody knows the answers to some of the questions that we're asking, and just kept saying that. So that's one thing, and I think it's getting a little clearer now. The other thing, having gone through SARS and we applied a little bit of a different approach, I think we had too many people talking about specific things, and we did a survey, a pandemic survey, and we've now distilled it down into one thing that goes out Friday with sort of, here's what you need to know, here's more detail if you need to know it, here's some links to documents. So those are two things I think that you know, will apply in the future to lots of things, but certainly from the experience that we've had on an ongoing basis.
I think, Russell, there's going to be, there will be a lot of academic material, a lot of books, a lot of magazine stories, a lot of articles, a lot of comms people looking back at all of this in terms of those lessons learned and do-overs and all of those types of things. And you know, there, of course, we can always do more and do better in everything that we do. And so you know, we are really, truly still in the midst of this. Certainly we know that there are lessons to be learned from the early days of this pandemic, and we've applied them now in terms of our, our social channels and how we organize our websites and those kinds of things. But and how we're organized, how we're structured. Do we have the right skill sets on our teams? And so I don't have a specific lesson learned that I'm going to apply now. It's going to be, it's really a bit of an iterative process, to be perfectly honest with you. And I think when all of this is over, and that day will come, that will allow us and afford us the opportunity to sit back and really distill all of this and have a good hard look at how we did our jobs and how we responded and communicated effectively, and where we didn't, because certainly there are going to be gaps that we can acknowledge for sure.
Yeah, certainly I would say one of the lessons learned for us is we have this sort of similar to Brad, to the Emergency Operations Center at OPG. We have a Crisis Management Communications Center, and there's a representative of communications on that team, and it's basically continuing to run the emergency response for the organization. And what we realized is we only had 4 people trained to be a member of that team. I mean, you don't anticipate that a crisis is going to go on for 6 months to a year and a half. Generally, I mean, when I was working at the city, a crisis would be a day or a few days or even a few weeks. And now it's just gone on and on and on. And we realized we didn't have enough bandwidth, to have the same person on the call every day, sometimes for 2-3 hours, and then, note the results of the call and the call to action and the action items, and then share them with the rest of the team and share them with the province, and still, develop communications off the side of their desk in the 18th hour of that day. So one thing we really learned is to have more people trained, more people able to respond to various sorts of emergencies. So it's not the same people doing the same thing all the time. And I think that tends to trip us up sometimes. So definitely I would say that. And also the other piece I wanted to say is, ensuring not only trained in the emergency response, but also trained in the various tools. Have more people who have the passwords to social media and the website. So if one person goes down, then someone else can take over. Because at the very beginning of this pandemic, we had to think about, what if half of our staff are sick and can't come into work? Then what do we do? Do we need to isolate people so they can stay healthy and work on shifts? I mean, there we're talking more about the operational staff, but certainly from the communication side, we have to think about that as well, and ensure that they're always backups, and in a broader sense, that we have a good succession plan in place as well, and there isn't only one person who can do something on the team.
Yeah, that the power of the team has become really obvious to me as well. I think Jackie made some really good points there. It's, you can't, no man is an island, and especially with all of the stresses that we have now. I mean, it's just bad business strategy to not have, a team of people, a really smart bench who can come in and play when you need them to play. I think it's traditional crisis comms planning and just regular comms planning to imagine the worst case scenario and continuously think of contingencies. If this happens, then what do we do? If this happens, then what do we do? Ultimately, the list now is incredibly long, which is stressful and I think difficult for communicators. But I think my one takeaway lesson from all of this is that while we're dealing with unprecedented change and everybody's stressed out and there are a number of problems we need to find solutions to, we can't give up on being creative and innovative. And we can't give up on trying to find new and interesting ways of getting people to connect with material and to connect with the truth. Because as the media ecosystem becomes more and more charged with content this fall, and I'm thinking particularly of the US election, I'm thinking particularly of the potential of a second wave, those things are going to make our jobs much more difficult. And the regular way of doing things, may continue to erode. And so I think we need to continuously, keep thinking about new ways. Not everybody's Paul Rudd with a cool video about masks, but maybe there are interesting ways that we can get people engaged. And I think that's the true challenge for for those of us in senior roles in communications. We can't give up, just because things are hard right now. We should push the envelope, and we should continue to take risks to try and get people to connect to the information that matters.
That's great. Thank you for that. I do have one final question before we wrap up at about 10:30. So that is a question that's actually been posed by two attendees, Cyrus and Anne Marie. And they posed the question of, we've certainly been evaluating or taking stock of some of the lessons learned throughout this long ordeal. So they're looking for, information about what you may have done differently or what you may have done sooner in your role as a communicator.
Okay, fine, I'll start. Those are really good questions. And I think, as I was saying, in my last answer, that we're really going to need to go back and have a look at that. But, I think having a more robust means by which to communicate with our employees, not all of whom are online. They don't sit at desks. They don't have email addresses. How we communicate with our workforce, who are diverse, who are geographically diverse, in meaningful ways, has been significantly challenging. And so I think looking at how we structure ourselves with respect to internal communications, depending on the size of your organization, of course, I think needs a good hard look, and so that we are ready. Certainly, in government, we focus on the public for obvious reasons, and so we are sort of built to react and respond quickly and to communicate with the public. I think, in all honesty, we were less ready to do so with the public service. We've certainly adapted and changed quickly to correct that, but I think going forward, when all of this is said and done, that audience it needs to be on equal footing, frankly, with your external communications, because, as I said earlier, in my view, an informed public service, an informed workforce is an informed public, because everybody's an ambassador. And, when I was at the TTC, I can't tell you the number of times, I'd be at a dinner party or at a, wherever, and, people invariably ask what you do, and you tell them they got a story, right? And they've got questions, and they want to ask you this, and they've got opinions on this. And so, so I think arming your employees with good, solid information so that they, can have those conversations in a meaningful way when they're out and about, I think is important. I think that's engagement with your workforce. And the other thing I would say is just, and we talked about this, I talked about this a little bit, and Jackie mentioned this, is building that confidence for your teams to take some risks, to give some advice and counsel that may be a little outside of what your comfort zone may have been, because these are not normal times, and especially using our digital channels to find creative ways, as Sophie has alluded to, or has said very directly a number of times, to be creative in how you communicate with the public, to cut through that noise. I think, to take some chances, I think is all very good advice.
So I think I mentioned a couple of things that I would do differently, but as I'm listening to this conversation, the other thing that I wonder about is the whole business of how we hire people and what our expectations are when we bring them into the company. And, an old story about, I don't know this, and, well, did you listen to this? Did you read this? Did you check the website? Did you go on social media? And there's this sort of like, well, I don't have time to do any of that. So part of it, I think, is also the expectation that we have of people who work for us to know what the tools that they can use are to find out what they need to know. And that's probably in the hiring process, and it's probably in the culture of the organization that says, we expect you to stay, to stay informed. I think at our place, I mean, education is a huge part, lifelong learning, continuous improvement of skills. And I think one of those skills are communication skills.
Yeah, if I can jump in a bit, someone had mentioned, finding those positive stories. That's something we could have done sooner for sure, because there were tons of positive stories out there, and we did find them after a while. And it's really determining which resources, which staff are available to go and seek out those stories. I mean, in normal times, I have communication staff that work at our stations, our nuclear stations, and they can just walk through and talk to people. But once COVID-19 came, there's basically a shutdown and only essential staff are allowed in. So our staff are again on the outside trying to find out information. We did find some great stories. There was one woman who works with us full-time in health and safety, but she's a nurse and she was working in a hospital on weekends. So, we were able to share that story both internally and externally, because we wanted to really humanize our workforce, because we don't have the daily press conferences as, Brad would have at the city, or, hospitals would have. We don't have spokespeople on TV every night, alluding to some of your clients, Sophie. So we really needed to get our stories out there to assure people that everything is operating well. There are not going to be any blips in power. Everything is going to continue to operate. Thinking back to that Pickering false alert in January, and people thinking, oh my goodness, there's something wrong. And we just wanted to assure people of that. So certainly that I would count that as one. Another one is, I talked about the town halls we did. We started the first one at the end of March, I believe, is when we did the first one. And the message from our CEO had gone out about 2 weeks earlier. A little bit of an inspirational message, but also factual, telling people that, okay, I'm expecting that all office staff are going to start working from home. And I'm sure there were a ton of questions at that point. We have this telephone line for our HR service center, and a lot of calls were coming through that line. We could have cut that off at the pass by holding an earlier town hall to let employees vent and talk and ask questions, because this was such an extraordinary time for our organization. So, the couple of things there, and, certainly the training that I've mentioned before, and some of those other pieces that you sort of do a post-mortem after the fact. I don't know when after the fact is going to be in this situation, and sort of go through, look at everything that you've done. We're even starting to forget now. When did we go back to normal communications? Because we did make that switch, sort of return to workplace. And then we, to give staff a sense of normalcy, we went back to our normal communication cycle, as opposed to these, crisis bulletins that were coming out. I think people get tired of that after a while. So certainly I think we did a lot of things right. But when you look back, we did a lot of things. It's just, okay, which were the best of those tactics? And how do we, cut to the chase and give employees the information they need? I think we all stumbled a little bit in the beginning. We're in a pretty good cycle now, but certainly for the second wave and, other issues, I think we'll be better prepared, as long as that institutional knowledge stays. As Jillian alluded to, there are people who are tired of all of this, don't want to do this anymore, heading out the door. And we need to make sure that all of these tactics, whatever we've done, is noted down, and we talk about what we can do better next time.
Obviously we work with, we have hundreds of clients both in Canada and around the world. So I think the only thing I can really offer is sort of a general sense of areas for improvement. For me, it never ceases to amaze me the lack of grounding in priority audiences. So I'll often ask clients, like, who are you trying to reach? And they will often not have clarity on who they need to reach. And I think given the current circumstances and the noise that's in the system, it's never been more important to really make some decisions about who you need to talk to, because you can't boil the ocean. You're not going to reach everybody right now. There's a ton of stuff happening. So where can you make a difference, right? And then how are you going to reach those people? And how do they want to engage with you? And it can simplify things, especially in a crisis where, you know, you prioritize the audiences that are most important, everything else sort of clicks into place. So I would say that. I'd also say, you know, traditional public relations is really dead and dying. The idea of, you know, top-down comms, where an organization puts out a press release and says, this is the word of God, you know, good luck and, you know, have a nice day. That's not how it works anymore. It's not about you or your company. It's about the conversation and the decisions you make about the role you're going to play in that conversation. Are you going to fuel it with information? Are you going to meet people where they are? You know, out there on Twitter every day, Brad trying to explain to people why it's important not to jump on city buses like idiots, right? Like, are you going to meet people where they are? And it takes a lot of time and attention. And yes, you have to be bold and take risks, but that's the new way of doing comms. And if we don't, you know, lean into that direction, we're going to continuously find ourselves frustrated. So I feel like, you know, I've learned a lot of lessons over the last 6 months about, you know, audience and about, you know, the conversation and the role that people can play in the conversation, and sort of thinking things through in that new frame has helped me a lot. And fingers crossed, the fall is easier than we expect, you know, fingers crossed.
Thank you for that, everybody. I certainly agree with that last comment here about fingers crossed. Let's hope it's a little smoother than we all expect, but nevertheless, here we are. So it's a few minutes before 10:30, so I just wanted to say a huge thank you to each of our panelists, Sophie, Brad, Jillian, and Jackie. I can't thank you enough for your wisdom and experience and expertise here. You know, I think we can all agree that we've learned a lot from you this morning, and you know, really value that you've taken the time out of your busy schedules to be here today. So thank you. I also wanted to thank each of our attendees for joining us this morning. I certainly appreciate each of you taking time out of your day as well to join us, and I hope that you took some valuable takeaways away from today's session. My last comment is that after the event, each of you will receive a survey, and I hope that you can take 2 minutes to provide us with some feedback on today's session. We're constantly looking for ways to improve and are always looking for new topics that you might want to have a PD session about. So I certainly encourage you to complete that. And otherwise, if you have any questions, comments, concerns about anything that IABC Toronto is doing, certainly feel free to reach out to me. My email is toronto-president@iabc.to, and I'll include it in the chat after here. But otherwise, thank you so much, and I hope that you all can enjoy what's left of your day. Thank you.
Thanks.